Myself, Shweta Jaiswal. I have almost 2 years of experience in lectureship. I am going to teach you pharmaceutics. At first, I am going to focus on basic points of pharmaceutics. So, today lecture, I am delivering a lecture on history of pharmacy, which is a topic of B.Pharm first semester pharmaceutics. Okay. So, today lecture is about history of pharmacy and next video is regarding the industry and organization and pharmacy as career. Okay. So, let's start our topic. At first, history of pharmacy. I am going to teach you one by one. First, historical background. Then second, how pharmacy education started in India. Then industry and organization related to pharmacy. Then what is a pharmacy and how as a career used as a pharmacy. Next, introduction to different pharmacopoeia. Okay, then we will discuss about the whole topic. It is about the unit first. Okay, now introduction to pharmacy. What is pharmacy? Basically, pharmacy is a Greek word. It is derived from the word pharmakon. ये कहाँ से derive हुआ है? Pharmakon word से derive हुआ है. Its meaning that means drug. Okay. What is pharmacy? Pharmacy is the science and technique of preparing and dispensing drug. Basically, it is a health profession which links health science with chemical science. It aims to ensure the safe and effective use of pharmaceutical drug. Now, what is pharmacist? Pharmacist, basically it is also referred as a chemist or druggist. Pharmacists are a healthcare professional who practice in pharmacy, the field of health sciences mainly focusing on the safe and effective medication use. Basically, pharmacists are licensed people. Okay, they are licensed people. They are mainly prepare and dispense medicines which involve in the patient's care, counseling in patients, monitor of the prescription from a licensed health professional. After that, there are some civilization of Mesopotamia and Egyptian. They also verified and concluded that the pharmaceutical sciences rose greater heights in these times. Okay, mainly these Egyptians, or we can say that they always uses some types of minerals, some types of plants, animals. Okay, they have set of standard weight for making the drugs. Okay, for set of standard weights for making drugs, they are basically use the one book named as a Materia Medica. Okay, Materia Medica, in which it deals with the almost 250 drugs of plant origin, 120 of animal origin and 30 of mixed. Okay, 30 of unimixed. They believe that the four elements, that is blood, water, air and Vikadu, that means body waste, okay, is a part of body. Mainly Vikharu main cause of illness. So they Egyptians or they Mesopotamians, okay, both are mainly focused on its removal from the body. That means the removal of the waste part of the body. Waste is material from the body. Okay. Now in 19th century it started developing as a separate profession. Okay, gradually it is developed as a separate profession. This happened only when the role of pharmacist as a compounder of a medicine was identified and differentiated from the physician, okay, whose role was accepted as a therapist. Okay, दैट मीन्स कि जब 19th सेंचुरी में धीरे धीरे जब सेपरेट प्रोफेशन के रूप में जब फार्मासिस्ट बाहर आया, दुनिया के सामने आया, वहाँ पे एट दैट टाइम रोल ऑफ फार्मासिस्ट को डिफाइन किया गया था. ओके, दैट एज ए कंपाउंडर ऑफ मेडिसिन. ओके, next, the practices in those times was restricted to compounding, dispensing medication and manufacturing medicaments in bulk loads. Okay, at that time when the role of pharmacist as a compounder of medicine was identified, okay, they are restricted. Okay, they are restricted to compounding, only to compounding, dispensing medication, okay, and manufacturing medicament in bulk lot. Okay, not for the general sale. Okay, the medicament commonly produces in like simple elixir, spirits, powder, okay, etc. Okay, they all are uses in pharmaceutical remedies for the modern era. In 1821, first school of pharmacy was established in Philadelphia in United States of America. Okay, after that gradually some pharmacy related acts or pharmacy related pharmacopoeia was established. Example, first USP was published in 1820, then APA, that is American Pharmaceutical Association, was found in 1852. Then next national formulary was published in 1888. The pharmacy profession in India was marked by the first class of the chemist and druggist. They are conducted at the Madras Medical College in 1870s. The main aim to conduct it at that college is to train students to gain skills in the pharmacy practice. Okay, why is it first class of chemist or druggist conducted at Madras Medical College in India? Because to train students to gain skills in the pharmacy practice. Okay, and the next program, formal training. Okay, formal training of the compounders, that was started in the 1881 in the Bengal. Next, the pharmacy profession entered India, okay, almost simultaneously with the US. Okay, both India and US, okay, both are the same parallelly work on the pharmacy profession, but growth in India remained very slow as comparison to US. Okay, for almost half of a century not much progress was noticed until B.Pharma course was started. Okay, when B.Pharma course was started in 1932 at the BHU. Okay, BHU Banaras Hindu University, which is situated in the Varanasi, and next B.Pharma course was started in the 1994 at Punjab University, Lahore. Okay, till time, okay, when the B.Pharma courses were not established, okay, till time not any progress was noticed. Okay, the B.Pharma course at BHU was industry oriented. Okay, while that at Punjab University oriented towards the pharmacy practice. Both are different in vision. Okay, mainly BHU was industry oriented and the Punjab University was pharmacy practice oriented. Okay, although profession was oriented towards the pharmacy practice at the introduction stage, as it is gradually grow, it becomes more industry oriented. Indian system of medicine, which includes that the that the Unani, Siddha, Yoga, Naturopathy and Homeopathy. Okay, this system, Indian system of medicine, they are originated inside the India as well as outside the India, but they are only adapted in India. Okay, these are Ayurveda, Unani, Siddha, Yoga, Naturopathy and Homeopathy. We will discuss about this all Indian system of medicine one by one. Okay, this all includes in the history of pharmacy. Okay, first Ayurveda, Ayurvedic pharmacy. What is Ayurveda? Okay, the science of life has arrived from the Vedas. Okay, Ved, around 1000 BC. The knowledge of Ayurveda is comprehensively documented by Charaka Samhita and Sushruta Samhita. Okay, mainly Charaka Samhita deals with the pharmacy and medicines, that means the herbs. Okay, and Sushruta Samhita mainly deals with the surgery. According to the Ayurveda, three life forces are there, that is Vata, Kapha and Pitta. Vata means air and energy, Kapha means earth and Pitta means fire. Okay. The Ayurvedic system of medicine is based on tridose. Okay, tridose theory of Vata, Pitta and Kapha. I have already told you that means they are basically based on the three life forces, that is Vata, Pitta and Kapha. What is Vata? Vata is a air and energy. What is Pitta? Pitta is a fire. Okay, and what is Kapha? Kapha is a earth. Okay, the three are the primary force of the body which develop from the Panchbhuta. Okay, which develop from the Panchbhuta. What is Panchbhuta? It includes Prithvi. Prithvi, that means earth. Second, Jal, that means water. Teja, that means fire. Fourth, Vayu, that means air. And fifth one is Akash. Akash, that means sky. Okay, that is all developed from this Panchbhuta. Okay, these all five elements is known as a Panchbhuta. Everything in the universe, including food and the bodies we possess, is derived from this Panchbhuta. Mainly, if we correlate with the body function, then Vata signifies the movement. Okay, Vata signifies the movement, physical and mental function. Okay, mainly it describes the sensation. Okay, sensation in a single cell, or we can say that sensation in the whole body. Okay, then Pitta correlate with the digestion. Okay, we correlate with the digestion. That means for digestion it requires metabolism. Okay, and for digestion it's required energy. So Pitta correlates with the digestion, metabolism and energy. Then Kapha. Kapha, if it correlates Kapha signifies strengthening the stomach. Okay, strengthening the stomach, functionality of stomach, the joints and providing firmness to the limbs and refreshing the sense organ. Next one is imbalance in the doses in the human body is the main cause of disease. Okay, according to Ayurveda, main cause of disease is what? Imbalance. Okay, so treatment of Ayurveda is based on the equilibrium and to balance among. Okay, it is based on the equilibrium and balance among this dosa. The diagnosis of any disease is done by questioning the patient. Okay, in Ayurvedic pharmacy, mainly diagnosis of any disease is done by the questioning to the patient. Okay, and some other examination like pulse rate, urine, fecus, tongue, eyes, and visual examination. Okay. Next, Yunnani system. Okay, Unani system. Unani system was established by a Greek philosopher that is known as a Hippocrates. Okay, Hippocrates. Mainly, Unani system focus on the combination of 4 to 5% animal, 5 to 6% mineral and 90% herbal treatment. Mainly, principle behind the Unani system is to proper functioning of human body mainly depends on the 7 factors. What is these 7 factors? First is arkan, that means arkan or anasik. Okay, that signifies the elements. Second one is mizaj, mizaj signifies temperament. Akahlat, akahlat that means humus, aja means organs, arva means vital forces, quava faculties and afal that is function. Okay, these all 7 factors is required for proper functioning of human body. Okay, these all 7 factors are required for the proper functioning of human body according to the philosopher Hippocrates. Okay. Hippocrates. Mainly the approach used in the Unani system by Hippocrates, that is they are using the different therapy for the treatment of disease. Basically they are using 4 type of approaches. First is ilaz-e-bil. Ilaz-e-bil tadbir. Okay, ilaz-e-bil tadbir that means regimental therapy. Second one is ilaj bil dawa. Ilaj bil dawa that means pharmacotherapy. Third one is ilaj bil yat that means surgery, and last one is ilaj bil ghiza that means dietotherapy. Okay, basically for the treatment of the disease they are using these 4 approaches. Okay, first is regimental theory, second one is pharmacotherapy, third one is surgery if required, then dietotherapy. They focused on the dietary modification. Okay, that means 4 basic elements are required. Okay, 4 basic elements or 4 primary components of human body is what? Fire, water, air and earth according to the Unani system. Okay, these 4 elements signifies the 4 different things. Okay, fire that means hot, water that means cold, okay, air moist and earth dry. Okay, humors are the primary body fluids corresponding to the 4 elements and their qualities. The 4 humors are dam, balgam, saffra and soda. Dam that means blood, balgam that means phlegm, saffra that means yellow bile and soda means black bile. Okay, these are the all 4 humors. Okay, 4 humors according to the Unani system. Now next system is Siddha system. Okay, next system is Siddha system. Siddha system. What is Siddha system? According to the Siddha system, food is being medicine and medicine is being food. Okay, the basic concept of the Siddha medicine are similar to the Ayurveda. Okay, similar to the Ayurveda. But the only difference appear to be that Siddha medicine recognize predominance of Vadham, Pitam and Kapam in childhood, adulthood and old age. Okay, that means Vadham in the childhood, Pitam is the adulthood and Kapam is the old age. Okay, but in Ayurveda it is totally reverse. Okay, Kapam is in dominant in childhood. Okay, Vadam is in old age and Pitam is same as well as in Ayurveda and as well as in Siddha. Both in the system Pitam is dominant in adulthood. Okay, but Vadam and Kapam it is a totally reversed. Okay, totally reversed in respect to Ayurveda. Now next system is Hemiopathic system. Homeopathic, the German physician. Okay, there is a German physician, Dr. Samuel Hahnemann. Okay, they introduced the basic principle of homeopathy. Homeopathy, um, it is mainly a combination of two words, homeosis, that means similar, and pathos means suffering. Okay, the principle behind the homeopathy is substance that cause symptoms in the healthy people. Okay, the symptoms. Okay, which is a mainly basically the cows. Okay, the cows, what is the cause for the appearance of symptoms can be used in the extreme dilution to treat the illness that cause the same symptom, that means like cure like. Okay, if they are have a fever, that means any pyrogen is present in the human body, that means they are using the same pyrogen in a extreme dilution method and they are introducing into human body, that means like cure like. Okay, basically, homeopathy system allow the body to heal itself by triggering body's natural immune response. So, we can say that the homeopathy system is basically based on the immune response or immune system. Okay. Next system is yoga. Yoga, as we will well known about the yoga, that is Sage Patanjali proposed yoga. Yoga, what is yoga? Yoga is a way of life. Okay, way of life. It contains 8 components. Okay, what is these 8 components? Restraint, observance of austerity. Okay, and next is physical posture. Okay, what next is physical posture and breathing exercise, restraining of sense organ, and contemplation, meditation and samadhi. Okay, what are these 8 components according to the proposed yoga? Okay, first is restraints. Okay, restraints means what is restraint? Restraint is a measure or condition that keeps someone or something under the control. Okay, that means unemotional, moderate behavior, self-control. Okay, self-control which keeps someone under the control. Okay, restraint. Okay, what is austerity? What is austerity? Austerity means severity of manner or attitude, in which is the severe case. Okay, if anything we observe of severe cases of any disease, okay, then physical posture, breathing exercise, restraining of sense organ, next contemplation. Okay, next is contemplation. Contemplation, what is contemplation? Contemplation means deep reflective thought, okay, which reflects the thought, the action of looking thoughtfully at something for a long time. Okay, what is contemplation? Contemplation is the action of looking thoughtfully at something for a long time. Okay, that means deep reflective thought, the thought which is inside your mind. Okay, next one is meditation and samadhi. Practice of yoga improves behavior, keep through better circulation of oxygenated blood in the body, restrain the sense organ and mind, and induce tranquility. Okay, induce tranquility. Okay, that means these are the all benefits of the yoga. Okay, what is tranquility? Tranquility is the quality or state of being calm. Okay, tranquility, that means it induces to body to keep calm. Okay, it keeps body calm. Okay, to keep calm. calm or peacefulness, etc. Okay, yoga also prevents psychological disorder and overcome stress. It also improves the intelligence and memory. Okay. Now, how evolution of pharmacist is take place? Okay, it is basically evolved by the 4 stages. First is traditional era, second is scientific era, then clinical era, then pharmaceutical care era, and next one is industrialization era. Okay, first one is traditional era. What is traditional era? Mainly early 20th century. Okay, in traditional era, it only focus on the formulation and dispensing of drug from the natural sources. Okay, basically pharmacognosy. Okay, pharmacognosy which deals with the natural plants, the study of the medicinal properties of the natural products of animal, plant and mineral origin. They also conducted animal experiments. It produced a systematic classification of drug for the treatment of diseases. Okay, this all about the traditional era. Now, scientific era basically it starts or it's begin after the World War II. Okay, scientific approach to medicine begin with the ancient Greek. Okay, Hippocrates proposed that disease came from the natural or not supernatural causes. Okay, the in scientific era only establishes theory of humors. Okay, already we had discussed about the humors or theory of humors in previous slides. Okay, next, emergence of the pharmaceutical industry. Okay, then how drug made in the factory is, it also signifies in scientific era, it also explained in scientific era. Pharmacy education emphasize, okay, also emphasize on pharmacy education. And pharmaceutics, how release characteristic of drug dose is taking place. Okay, that means pharmaceutics, pharmacology, pharmacy education, drug preparation, okay, all are established in scientific era. Then clinical era. In clinical era, it is started in 1975. Okay, clinical era is also known as a pharmacist for the future. Okay, here new educational emphasis on clinical pharmacy. Okay, in clinical era, it mainly emphasize on clinical pharmacy. That means pharmacokinetic activity, the activity of drug within the body. Okay, how the drug is act within the body, that means pharmacokinetic. Okay, what the drug does to the body, that means it includes ADM study, that means absorption, distribution, metabolism and elimination. Okay, next, also in clinical era, pathophysiology is emphasized, that means the study of disease and illness, okay, affecting the normal functioning of body. Okay, how the disease is affecting the normal functioning of the body, that means whole pathophysiology was emphasized in clinical era. Next one is industrialization era. In industrialization era, it mainly focus on the development of the manufacturing of medicine. Okay, it mainly focus on the standardization, biologically prepared products, complex chemical synthesis. Okay, this all are focused in the industrialization era. That means they only increase the industrialization of the medicine. Okay, then pharmaceutical care era. In pharmaceutical care era, a philosophy that expanded the pharmacist role. There is a expansion of pharmacist role. Okay, it include monitoring, of drug response. Okay. Or second one is educating patients. The beginning of this era mainly concentrated on research to develop new medicine. Okay, when new drugs were developed, had a lot of adverse reaction to drugs, so drug review and monitoring resulting is another role for the pharmacist. Okay, pharmacists begin to take a more hands-on role in dispensing medication and patients education. Okay, so this all about the history of pharmacy. So in next video I will cover the next part of this topic, that is industry and organization and pharmacy as a career. Okay, please subscribe my channel so you will get a notification and continue learning.